Okay, so this segment is going to talk about investigator product or investigator device reconciliation. So, first and foremost, you need to understand how the investigator product or IP or test article TA depends on what verbiage the sponsor decides to use. You need to understand how it's going to be or how it should be stored, whether that's ambient, refrigerated, or frozen. That's first and foremost, because once they get that box that arrives on site, it's going to be a temperature log in there. We call it tip tail, and they should immediately stop it, and they should immediately place the kits into the designated storage space. With that being said, that box should also have what's called your shipping documentation. It's usually a place on there for you to acknowledge that you received. If it's not there already pre-populated on the page, it is good standard practice to just write it on the document. So if they didn't have a line for a receipt, acknowledge your receipt, create your own. Draw a line, received on such and such date, such and such time, initial. This is important because if there was an excursion, it kind of explains why, if that IP was not shipped overnight like it should have been, because typically IP is 1 day or 2 day shipment. Usually if it's frozen or refrigerated, you're going to get it the next day. If it's ambient, you might get it, within 2 days. So pay attention to that tip tail. That tip tail usually have a USB cord attached. That is for you to attach into your computer, whether that's a laptop or a desktop, and you save the report on your desktop, because anything can happen and when you label that file, you need to put the order number and the date it was received, and that'll help you keep up with your documentation. But of course, you should print it if you have a paper investigator site file and place it in the appropriate section of your ISF. So I just talked about acknowledging the receipt on the documents. You're going to file that shipping paperwork. And I also talked about looking at the report. If that report indicates that there was an excursion at some point, when you arrive that medication in the IRT system, you need to indicate that there was an excursion, because it's going to ask you, was the drug received in good standing? And that is going to be no. Now, good standing could be related to the temperature, and that could be related to damaged kits. So make sure when they ask the second question, excursion or damaged kits, you indicate the appropriate response. Okay, now we got to get into how many kits was on that shipping document. You need to count to make sure that the number matches the quantity that's on your shipping documentation. Then you need to quickly do a reconciliation of the kit numbers. A reason why I said quickly, because you don't want to impose a site excursion because you kept the freezer open too long or the refrigerator open too long. So ideally, as you're placing them into the place where they should be stored, you are looking at kit numbers and your shipping documentation. And then you're all done. So you've acknowledged the tip tail, you downloaded it, and you filed. Hopefully it has a check mark to show it's in good standing. You have counted your IP and compared it to the shipping documentation and noted that it's the same. Then you compared your kit numbers. Now, are we done? No, we're not. You're done with the stocking of your IP, but you're not done with the whole process yet. Because all of those kit numbers and that information from that shipping documentation needs to go onto what we call the master IP log. And typically what's asked on that log is for you to include the order number, the lot number, the date it was received, the initials of the person that received it, and each kit number, and sometimes, but not all, the expiration date. I would encourage you, if the expiration date is listed on the shipping documentation, but not listed on the master IP log, that you do a log per order and you include somewhere on there the expiration date. Because although usually the IRT is designed to not randomize a participant or redispense drug to a participant for a medication that is expired, you want to have a verification process at your site as well. And sometimes, but not all times, the expiration date won't even be on the kit because it's associated to the shipping documentation. So that's why it's good practice for you to acknowledge the expiration date somewhere else. And it's even okay if you include it in your source. So when that IRT confirmation letter is sent to your email for that particular participant, it's okay if you want to add the expiration date to that IRT system, like standard operating practice for your site, because it acknowledged that you double checked and you made sure that that medication was not expired when you administered it to that individual. Another thing I would suggest that you put into place to minimize medication error, just like we have the I think it's called timeout. Just like we have the timeout process in the hospitals that we re-verify the subject, well, at this time it'll be the patient. We have the patient state their name, the date of birth. We have one person reading off the medical record number while the other person looking at documentation of that medical record number, and then they say out loud the procedure that's going to be done and the side in which it's going to be done, and know the patient and that second person they verify. That's the same process we need to do when administering IP. And if you don't have another site staff person, you can do it with your patient. Give the patient a kit, have the patient call out the kit number to you, and you look at the IRT log to make sure those numbers match. If those numbers match, then you provided the participant with the appropriate medication. Now you got to be very careful if the study is unblinded, has an unblinded arm, because sometimes the labeling of those IPs show whether or not the drug is active or placebo. That all placebo might be one color and all active drug might be another color. And so it's things put in place for you to prevent the participant from looking at the kits and looking at the pill bottles. So make sure if you're using that practice of reading off the numbers, that the participant does not have access to the kits. So you could possibly, and don't give them the IRT confirmation either if it says placebo versus active drug. So that's why it's best practice to use another unblinded staff member or another person that's designated to IP.